Hi, I'm Dr. Salil Khandwala, the Medical Director at Advanced Urogynecology of Michigan, and also the Fellowship Director at Corewell Health. This is March 2023, and it is Women's History Month. So let us talk a little bit about pelvic floor conditions in women. March is essentially the month to celebrate and recognize the contributions made by women to society throughout history. Though March 8th is celebrated as Women's Day, the entire month of March is recognized in honor of women. It is time we as a medical society also give back to women by improving their health care. Let me, in my own little way, begin by shedding some light on some of these pelvic health conditions. As a backdrop, I'm a fellowship-trained urogynecologist and reconstructive pelvic surgeon, and I did my fellowship in Baltimore in 1998. I was very fortunate to do my fellowship with one of the first ever urogynecologists in the US. I'm also an OBGYN by training, and I was the first in US to get the URPS certification and have been practicing urogynecology for the past 20 years. I am also the Fellowship Director of URPS or Urogynecology at Corewell Health and have been training fellows for the past decade. Urogynecologists like myself exclusively manage women's pelvic floor conditions that include conditions of the bladder, the uterovaginal area, and the bowel. So let's do a little bit of an overview of the female anatomy. So here's the head end, this is the foot end, this is the front, this is the back, just to get an orientation, and you're looking at the woman from the side. So this is the pubic bone. Right behind that sits the bladder. Behind that is the uterus. Below that is the vagina. This is the urethra, which is the tube that brings the urine outside. And then you have the rectum or the bowel at the back. These organs are supported by the pelvic musculature. The typical urinary condition that we see are urine leakage, whether it's stress incontinence, which is the coughing, laughing, sneezing leakage, or the gotta-go problem or the urgency leakage, and difficulty emptying the bladder and even bladder infections. From the uterovaginal standpoint, it's the vaginal bulge or prolapse and vaginal atrophy or thinning of the vagina causing pain during intercourse and otherwise, which typically happens after menopause, and bowel conditions of constipation and leakage of stools. So as I mentioned, stress incontinence is the leakage of urine that happens with strenuous activities. Urgency incontinence is the gotta go feeling. A vaginal bulge, as you can see, all these organs are normal, but here the bladder and the rectum and the uterus are tending to fall down. That's the bulging coming outside. Constipation could be because of a tight muscle or some bowel motility issues where the stools just don't come out. And bowel leakage is where the sphincter muscle gets sometimes weakened or torn, and then you have leakage of stools. With menopausal changes, the lining of the vagina can also become very thin and cause atrophy, and this thick lining becomes extremely thin after menopause, causing pain during intercourse and vaginal discomfort. Now, all these conditions that I talked about are not rare. They happen in at least 1 in 2 women are bothered by this. So it's not that it's just there. They're actually bothered by these pelvic floor conditions, and they affect their quality of life. That means it affects them from doing activities like they would want to do. For example, going outside the house, going to see a movie, engaging in relationship with their partner. So all that and sexual function is affected by these pelvic floor conditions, and they can happen at any age. You may feel that this happens in the elderly, but that is a biased statement because typically we see it in the 30s and the 40s. There is a tendency for women to wait, and that is why we may see a larger portion coming in their 60s, but the condition may have been as bothersome to them in their 30s. This is the problem. The sad and the unfortunate fact is that women wait at least a decade before seeking treatment, a decade after the problem becomes bothersome. They feel that wearing pads is the only solution, and they feel that these conditions are just part of getting old. And they have a feeling that there is no treatment available And unfortunately, they get no or misinformation from their doctors and from the media. Doctors do not address this during physicals. You come to your gynecologist for a pap smear, they don't ask you, do you have any bladder leakage problem? Do you have any bowel problem? Do you have any discomfort during intercourse? Even gynecologists don't ask, leave alone primary care physicians. Doctors also do not know the new advances that have happened in our field. And some of these advances are not very new. They have been around for a decade. But doctors are still talking about these obsolete things such as bladder suspensions. I have not done a bladder suspension for 20 years now. Unmonitored Kegel exercises, just go and do some exercises, but we don't know what they're doing. They do not recommend anything. Wait until it gets bad. It's already bad, did you ask her? The true facts, are all these pelvic floor conditions can be treated and can be treated satisfactorily to the patient's satisfaction and acceptance. Pelvic floor dysfunction, what I just showed you, is a medical condition. And just like any other condition, there is no reason to be embarrassed about it. It's just like high blood pressure or diabetes. The surgical procedures are not cosmetic, but are medically necessary, and they are covered by insurance like any other surgical procedure. Most of these conditions, most if not all of these conditions, can be managed in my office, in a doctor's office. Pads are never the solution, never. Most of my patients remain cured and satisfied with their outcomes. And even if they have to go to get a procedure done in an operating room, it is done in an outpatient center with most of the patients going home the same day. Or if I do these large prolapse cases, they'll be going home the next morning. With the sling and the overactive bladder procedures, most patients can go back to all normal activities the very next day. The results are instant and they are sustained and very successful. And most of these procedures can be done completely under local anesthesia with maybe slight sedation. So having known all this information, first of all, how common these things are. Number two, this is a medical condition. It's not part of aging, and there are solutions. Most of my patients will tell me, how come no one, including my doctor, informed me about these treatment choices? I would never have waited this long had I known. So 1913, way back, 1913 is when the women's suffrage parade happened. Why are women still suffering in silence? Why cannot we have a parade to help improve women's pelvic floor function? If you have gone to New York City, you will see this fearless girl statue that they put up right across from the bull, the Wall Street icon, challenging the bull. And this is time. It's time to break the ceiling. It is time for equality of healthcare for women and men. It is time to stop labeling medical conditions as embarrassing. It's time to increase awareness of these conditions. And finally, it is absolutely time to stop wearing pads and suffering in silence. So, ladies and gentlemen, as we celebrate this Women's Month of March, it is time that all of us, men, women, doctors, healthcare providers, or anybody for that matter, recognize women and help them overcome these very common pelvic floor conditions, as most of these conditions can be taken care of in a doctor's office. Thank you.